Hello, everybody. This is Gary. Today is Friday, September 30th, 2022. It's 1:39 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today I'm doing pretty good. I'm sticking to my daily schedule. I did some work on my computer. I do consumer surveys for extra money. I did my physical therapy and walking exercises. I did my morning meditation, and I'm making this video as part of my daily schedule. Yesterday, I saw my peer support specialist. Um, she had somebody that she wanted to sit in on our session, and she didn't ask my permission ahead of time, so I refused to do that, and I just met with my peer support specialist alone. Um, and I was pretty angry yesterday about the whole thing. I don't like it when my therapist, my psychiatrist, or my peer support specialist brings in a medical student to observe our sessions at the last minute without telling me or asking my permission. So I refused to do the meeting with somebody else in the room. It's a matter of confidentiality and respect. And so I met with my peer support specialist alone. As far as my psychiatric symptoms are concerned, my auditory hallucinations are at a bare minimum. My paranoia and delusions are not that strong. My depression is not that severe. My anxiety levels are way down. We increased the dosage of my Klonopin, which is helping control my anxiety better. I'm having less panic attacks. I'm sleeping better. Um, and of course, the Klonopin by itself is not an answer to all my anxiety. Sometimes anxiety is a good thing. It warns you of danger, physical danger. But a lot of the time, it doesn't serve any purpose. And so I do meditation. I do my walking. I do my work on my computer. I make these videos. All of these different things, keeping my daily schedule helps control my anxiety and helps me function despite my paranoia, my auditory hallucinations, my delusions, my depression, and my anxiety. I am meeting with my therapist, I believe, on the 12th of October. Tomorrow will be the 1st of October, and I'm seeing my peer support specialist again on the 13th of October. I decided not to go with a care manager because after talking to the person that might have been my care manager, she didn't say she could do anything for me that I wasn't already doing for myself, whether that's dealing with Medicare, Medicaid, food stamps, Social Security, my rent subsidy, my lease. I just renewed my lease. A lot of paperwork. I did it myself. Didn't need the help of a care manager, so I saw no point meeting with a care manager. I think it would just be a waste of Medicaid's money. There's no point in using the service that I don't need. Because they can't help me with doing things that I'm not already doing for myself. I met with my primary care nurse practitioner a couple of days ago. We really didn't change anything. My blood pressure, when they took it, was fairly low, so there was no addition of blood pressure medication. My cardiologist had told me to buy my own blood pressure cuff, which I did, and my blood pressure was consistently high. But when I went to the nurse practitioners, my primary care, my blood pressure wasn't that bad, so they didn't add any medications or raise my blood pressure medications. I think they should have. They didn't. I have to go with what their decision is. They said that if I do have high blood pressure again, they would add a medication, not increase the two medications. I'm already on. My pulse was very high. It was like 113 beats per minute. That could have just been anxiety, frustration, anger, uh, my paranoia. If I get nervous, if I get agitated for whatever reason, of course my pulse is going to go up, my heart rate's going to go up. That's true for anybody. I don't think it's a big concern. But my weight is at about 222 pounds, which is heavier than I want, so I'm still trying to lose weight, diet, exercise, that kind of thing. Seroquel and Zyprexa can both cause obesity and diabetes. They sort of shut off a part of the brain that tells you when you're satiated, when you eat food. And so you eat and eat and eat and you gain weight. And so I'm up to 222 pounds. They did not take my blood pressure or my blood sugar levels, and they didn't check my cholesterol levels. I'm seeing my primary care nurse practitioner again in 6 months. There's nothing going on medically that needs immediate attention. So I saw no reason to see her anytime sooner than that. If something comes up, of course I will call her and let her know. But right now, there's not much going on medically, and today at least there's not much going on with my psychiatric symptoms.